Sorry it's been a while since I put up a video. I hope everyone's doing okay. I have been dealing with a lot lately. So past my 6 years since confirmed diagnosis, October 4th was the confirmed diagnosis of ALS, C9orf72 genetic form of ALS I have. I'm a limb onset patient. Left lower leg, my left foot, I have left foot drop, my right is starting. I never expected to be living this long. I mean, you know, when I was first diagnosed, my first video talked about that and then talked about disability. There has been, you know, most recently the Act for funding research, which thankfully many people have testified to hope that they will continue funding ALS research. But once you're confirmed diagnosed with ALS, even though it takes the average person 2 years to get diagnosed, I'm familiar with the symptoms, going to different doctors, and ALS is usually a last case diagnosis. But it's almost immediate once you're confirmed diagnosed under the compassionate allowance that with ALS that you're streamlined on Medicare and Social Security disability, or if you're older, Social Security access, which is pretty amazing. Now with our current administration in the U.S., and this is for people in the U.S., you know, I know that Canada, Australia, Europe, different countries have different approaches in how they take care of their people with ALS or MND. I happen to be a person that had ALS in my family. My father had a different form of the C9orf72 genetic diseases. He had frontal temporal lobe dementia with symptoms of MND. Two of my uncles were diagnosed with ALS. One with ALS FTD, the other one with ALS. Though with talking with my aunt, he did have some symptoms of FTD. Now being with C9 and being in the studies like the Artful study and the, it's connected with, it used to be the LLFDS, but it's now all under Artful. Which we'll see how grants are, if those grants have continued. You know, it's like with C9, you know, people say, well, you will have FTD. Currently, I don't have any symptoms of FTD. I do see a neuropsychologist every year. I have family members that are aware of the disease, that have my consent to seek treatment. I've done everything I can for that, but I hate, because I have this kind of like a BRCA, which is a different form of a genetic disease that puts you at higher risk for breast cancer and uterine cancer. That's like telling a person that carries BRCA that you have breast cancer and you have uterine cancer, even though they don't have it. They have a higher risk of it, even though they don't have it. So some of that study with the FTD registry, it's like, well, if I have ALS, I don't have FTD yet. Annoying. But so I've been a lab rat for it. Currently I'm expired because I am a long living person with ALS. Once you're past 3 years, they don't like to use you in clinical studies. Now there are the EAPs, which are extended access. I have not had one that my doctors have found that I would be a prime subject through that. For my form, they're talking about doing ASOs, and there's clinical trials going on with that, which is awesome because that's going to treat one part of it. The Koya 302 is now in phase 2, which will be in the Healy platform, which for my form of ALS was amazing. That could be why I've extended my life has been extended, why the process has slowed down in me. I don't have access because I, you know, am past that point. but I really have great hope for it. I think that that will be a treatment for my form and hopefully some people with sporadic ALS. Because some of the things like SOD1 has a treatment. Thankfully, some people with another genetic form of ALS are getting, true breakthroughs. So let's hope that everyone, especially those that are sporadic, genetic ALS is 10 to 12% now that's known of ALS. My form is about 60% of that. So a lot of people with ALS are sporadic, and I hope that these treatments are funded so that people with ALS can get treatment, that it's not just a fatal disease, terminal disease that no one can treat, and you don't know how long you have. Now, being somebody that's longer lived with ALS, and I found that this has kind of hit me. My family members generally lived 18 months with the disease. Now, they were older. They were about two decades older than me when they got diagnosed. I had 2 motor vehicle accidents where I had 2 concussions. The second one was a really bad concussion. I had post-concussion syndrome. I hadn't thought that whiplash was real, but it is real. Isn't that terrible of me? But I got better. In about 8 months, I got worse, and I started having motor neuron dysfunction. But I'm kind of at a plateau right now. I am weaker. It's like this is my allergy season. So, I'm allergic to mold and ragweed. And in the area I live in, what is high? Mold and ragweed. So, like, when a normal person can push through and live normally, my fatigue level is higher now. Even though I try to eat well, I manage my other conditions as best I can. It's just I don't have the energy I would like to have, So it's just kind of down. I was on steroids because I had a really bad reaction, and I really thought, palliative scale, I would be about a 60, 70 to 60. But I was like, oh gosh, I'm dying. Now I was just having bad allergies and it was worsening it. So I'm about a 70 on a PPS scale. I'm on palliative care, but I'm not quite on hospice. Though I've noticed over this summer, I had a busy summer. Got a brand new granddaughter, little Scarlet. Sweet as anything. But just life is so precious, and being around a new precious grandbaby and being here for a new precious grandbaby, what a gift. And being here for my 13-year-old daughter, what a gift. But I started having these issues, constipation is a given. I have to do mag oxide, which, I take, and 200 to 400. And, it helps if I don't need that magnesium. It helps me move my bowels. When I am not feeling well, if I'm very spastic, I'm not moving enough, I do get constipated. Some of the medications I've been on, have made me constipated. I dealt with that, but I started having these projectile vomiting situations where I would just vomit out of nowhere and just wake up and vomit, or wake up and just multiple vomiting until it's almost like bile. I would have a sour taste in the back of my mouth, kind of like heartburn, and it would the next day that would happen. Happened during my daughter's second baby sprinkle. It happened when I was with my daughter, waiting for her she was having, those contractions that don't lead to labor but could. And I one day vomited there. And it happened again. And finally, because of my daughter's pregnancy and things were going on and I was out of town, I had to keep moving my gastroenterologist. So I went to the gastroenterologist, stomach doctor, talked with her. Because I'm also diabetic, they always worry about gastroparesis, which didn't get diagnosed until 2015 with that. It's familial and kind of went rapid from being, I watched my blood sugars all my life. I ate low carb and diet drinks, you know, from my early 20s on, because my father and his father and my aunts and uncles are all diabetic. So didn't get diagnosed until I was like 46, and my gallbladder already died, but my pancreas kind of like went defunct about 2 years later, and I got on insulin. But I've tried to keep my hemoglobin A1C under 8, and I've been pretty successful until eggnog. I mean, hey, I've got ALS, you know, dying. I will enjoy eggnog when I can, but it does kind of make my hemoglobin A1C creep up. Been started on Jardins, which helps my heart, protects my heart, and it, you know, you lose your sugar through your urine, kidneys function out. That with my insulin has really helped it. So, you know, my blood sugars stay under 150 most of the time. I don't have any neuropathy or retinopathy. I don't have any neuropathy. I can still feel the bottom of my feet, my toes very well. I know that, and I talked with my primary doctor last week, that ALS can cause motility issues with the slowing of the GI tract as well. So I have been very cognizant of trying to eat protein, but lower residual foods, and, you know, try to increase my fiber so everything flows. And so far, so good on the Nexium 40 milligrams prescription. You know, so far I've only had one episode since that started. But next week I go in for a EGD to see if it's something with my stomach. Hopefully I have GERD, I have a hiatal hernia. Hopefully it's something with that and not, you know, the dreaded gastroparesis, or if it's ALS. I don't know. I mean, one thing I have thought about is that I don't want any tubes. You know, G-tubes, you know, I'm at a state where it'd be better to get it. You know, they say get it before you have problems with your respiratory. My breathing, you know, I'm at 140, you know, plus, you know, I'm breathing well, and my diaphragm is intact, which is amazing 6 years in. You know, with ALS, anything can change at any time. But this has been a blessing for me to be here. But if digestion is that, you know, it's like, I know that Medicare does not pay for enteral feeding. I'm on SSDI. I don't, you know, cost of living has gone up. I can't afford Jevity. I can't afford a lot of the Glucerna things. I can't afford that. I do drink low sugar, no sugar supplements, you know, mixed in with berries that are high fiber and stuff like that. I do drink the things, but I don't want to have to have enteral feeding. You know, that's not a choice I'm going to make. So I'm really hoping it's not the gastroparesis or extreme ALS affecting my motility. You know, I can get up and try to walk, and, you know, I don't know what I'll do when I'm frozen. And when you vomit like that, you know, you worry about your respiratory, because, you know, if you're uncontrollably projectile vomiting, you know, you can actually breathe the wrong way and have aspiration. Aspiration pneumonia would be a way somebody that has difficulty with respirations, with secretions, with that, can die. So it's just kind of coming to a point where I have to make some hard decisions. You know, I'm allergic to paper tape. You know, the thing that you're supposed to use for delicate skin. Go figure. You can put cloth tape, you can put masking tape, you can put IV tape, and I have no reaction to it. Band-Aids, no problem. But that paper tape causes a red rash, raised red rash. I don't think, with the problems, with the pressures, with the way my heart goes, I carried my fluid in my abdomen. So if that was going pressing back and forth, having any leakage of stomach acids or that would be a problem. Just not something I'm going to go under. So I don't know what the treatment will be if it is a mechanical problem like that. I know there's some medicines that could help. One thing with pain control, right now there is a major problem with, they worry about opiates with breathing issues with ALS. And they say ALS is not a painful disease, which is a lie, especially if you have spasticity of pain. I have recently gone through being weaned down and off gabapentin. Gabapentin, is a seizure drug that they cross use for pain, chronic pain. They use it for hot flashes. They use it for a lot. Now, for gabapentin, you actually affected my speech. It dumbed me down. It made it harder for me to have word recall. It was awful. And I do have neurologic or nerve pain. I have multiple pain, from bones, from, muscles to, things that pull on nerves. It's terrible. I'm now on pre-GABA, which is Lyrica, and I'm on a lower dose of that, so that's helping. I still have other issues where somehow I pulled my lower back, and now it's caused sciatica type, not sciatica, but that kind of pain on the front of my thigh. So I'm doing some physical therapy things that are helping a little bit. I have orders for physical therapy, doing those to help. Just kind of nervous about the EGD and potential motility testing. I mean, I'm hoping the EGD shows it. It's just, out of nowhere. I mean, vomiting. I mean, I don't eat bad, rotten food. I don't eat out that much because, I'm afraid of choking. Being on one of the clinical studies I was on caused dry mouth. I take antihistamines, which right now I'm not having as many secretions because of the high doses of antihistamines I'm on. I also have a medication that is a nasal medication I can use under my tongue. And I have Robenal, which, Robenal is great to dry things, but it can cause more constipation. So I've really got to be careful with that. So I've got the secretions, potentially covered. Right now, they're not as a problem, but I have to be careful and have fluids next to me and do the chin tuck when I have food, because I can, when I'm chewing, I can choke really easy on drier foods. Chips and salsa can be very dangerous. Cornbread and angel food cake. Even though I love angel food cake, I'll do tomorrow, they can be dangerous. So, you try to eat around. Currently I'm really loving my smoothies, my protein and fruit and kale and spinach and all that, lovely stuff, and keeping my blood sugars good. So I'm trying to eat solids at least once a day and making sure that I have bowel movements at least daily. And increasing activity does help. I mean, if I can walk a little bit on good days, it does help. So it's just kind of like the physical, it's like new symptom, potentially related to ALS, vomiting. I don't know. I really hope that's not the slow. I mean, it's like if you don't move, you do slow. I mean, I am on a low dose pain medicine, which could cause constipation, though I don't take it unless I absolutely need it. Getting off the gabapentin has helped reduce some of the constipation and the dumbing down. I mean, I'm serious. Right now, with people with chronic pain, we're stuck within the apparatus that is trying to help the addicted. that is trying with chronic pain patients medications that are not labeled for chronic pain. Like they offered me Suboxone. You know, I'm not a opiate addict. Suboxone made me vomit 24 hours straight. You know, it was basically to replace 150 milligrams of morphine, which I've only had 1 milligram of morphine in my whole life. Awful, 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 awful. You know, you can't be on a benzodiazepine and an opiate now. You know, I had found Valium to be effective when I was really badly spastic. I can't use that anymore. I'm on codeine and Tylenol for pain, which does work. I mean, it's not the strongest. It doesn't take it all away, but it dampens it. Delirica does help. You know, the gabapentin did help, but it had too many side effects. You know, you hear that it can actually cause dementia. You know, it's kind of scary that they're giving that to people with hot flashes. You know, it's like, no, thank you. I mean, you know, if I've never been an addict, I'm over a certain age, I'm probably not going to be an addict. But there's a whole, you know, these interventional pain doctors. I mean, they try to give me shots, you know, it's like, well, you can try, but you'd have to give me, you know, lidocaine and dexamethasone shots all over my whole body. But, you know, I'd probably end up having high blood sugars and probably die from toxicity, but it's not going to stop it. You know, it's like, you know, people that get spinal injections. I mean, it's just this unproven quackery. You know, they like, oh, well, you can beat that, but put on Suboxone. Suboxone and buprenorphine can ruin your teeth. So it's toxic to your teeth. You know, someone that's already had some problems with their teeth, I'm so glad I reacted that way to it. It's really scary. Really scary what they're doing. If you're diagnosed with ALS and if you feel like you are having severe pain, you know, talk to your doctors about getting palliative care. Now, some palliative care places say they don't use opiates. They're the non-opiates people. I would not take Suboxone. I'm very hesitant about gabapentin. You know, Lyrica, so far as working, it's still in the same class of stuff, but it actually does help with the pain, and it hasn't caused the mental problems like the gabapentin did for me. You know, you just have to find the right doctors, you know, find the right palliative care doctors, and have a doctor that listens to you, that respects what you say. You know, it's really hard. You know, going through having ALS, I have been medically gaslit so much. Even though I think I have excellent caregivers, it's just really hard. So I'm glad I've got that taken care of. I'm glad I have a good PCP. I'm glad I have a good palliative care doctor. I'm glad I have a good ALS doctor. Though, you know, my little sister moved into the same vicinity I live in, which is wonderful. You know, she's like, oh, I can go to your ALS clinics. I was like, yes. So that will be wonderful. You know, just having family close and have more nieces and nephews to spoil. They get to learn and see who their aunt is, which is wonderful. Kind of like my granddaughters getting to know who their Oma is. You know, my kids already know who I am. So just trying to do things for Halloween. You know, it's kind of like my ALS fatigue on top of my allergy fatigue has made it a little bit difficult, but I am getting the holiday together, you know, strength and doing things, and, you know, the fine motors that issues that I'm having, I have gotten some up, which is great. I don't know, I love the holidays, you know. Thanksgiving will be interesting, though. We will probably be ordering in from a restaurant food. You know, this month is my husband's birthday, so he hasn't decided. You know, it looks like it's going to be a Jewish deli. You know, where it is, we're not sure. You know, his mother's going to come. She's excited about it, so that'll be nice. Just, you know, surround yourself with family. You know, just love. You know, I've stepped back from some of my advocacy because I have had these problems and my physicality is lower than it was. So it's been hard, but I, you know, kind of had to realize that there's some things that take more emotional cost, you know, and sometimes I've gotten re-traumatized talking about things, It's just kind of hard that I've had to step back a bit. As much as I love doing that, as much as I love the organizations, it's just, sometimes you have to say, uncle, or, wave the right white flag. It's okay to do that. It's okay to stop. You can find other loves that you have, other things that you really want to do. I'm gonna have, for my sister's birthdays later in the month than my husband's, we're gonna go see Father Mike. I can't remember his last name. He's a comedian, so we're gonna go see that. And she might want Tex-Mex, coming in from a totally different state. She's been starved of Tex-Mex. So we'll go do that, and just spending time with the people I love, friends and conversations I have, it's just, that's important, Later this week, I'm gonna go with my best friend and get our toes done, which is good because I can't paint my toenails well anymore. I am not an exact toenail painter anymore. I used to paint, I used to do things, but not as accurate. I wouldn't be as accurate with whiteout anymore either. I don't know. Just kind of slowing down a bit, Grateful to be here. Having, as a slow progressor, a little bit of survivor's guilt because there's been so many people, beautiful people with ALS I know that have passed away. I can't control it. I said nothing. Oh, you can control your ALS and live longer. I don't think that's true. Now I'm a slow progressor. I decided to, take care of my trauma, deal with my life and my childhood stuff and get in counseling, because I have seen people, with being a retired hospice nurse, did a lot of nursing, mostly in cardiology, ER, ICUs, CCUs, all that stuff, right? IMCUs, all of that, worked around the hospital. Do not regret retiring from nursing. My heart goes out to nurses right now that are in there for the right reason, but healthcare is kind of messed up, Shareholders, for hospitals, shareholders for insurance, it's like, that's just kind of a screwy thing. United States has some stuff that's messed up. But I love what I did. I'm glad to be retired. But I knew that seeing people at the end of life that had the trauma and the childhood difficulties I did, and how they cried and they relived their life review, I didn't want my family members to see that. So that's one of the reasons, kind of get that stress off my nervous system. I went through classes to teach meditation, did meditating. I still facilitate meditation. I do meditations. Being a night nurse, somehow my voice registers and I have a skill that way. So I do that for a group as a donation. Each month I do a 30-minute meditation for people. It's just, if it helps people, it helps people. That helps. I'm a person that likes to help. So that's kind of, that does make me feel better. It's just, but I keep, prayer and meditation, have been a big help for me. The counseling has been a big help for me. Finding the space between has really helped me. Finding beauty in every day, even if you're flat on your back having a bad day, there's something beautiful. It's not looking at the worst of things all the time. It's kind of like, I think if you put your head, like you have ALS and this is all you look at, I have ALS, I have ALS. You identify with your disease, you become your disease. I think if you worry and you have all the panic, you're going to have problems. I mean, you're going to, it's not a healthy way to look at things. I don't think you really have a lot of control over all of it. It's how you respond to it. You take care of your body. You take care of your other health conditions. You take care of your mind, body, soul, right? A lot of it's surrendering. It's you surrender and you're blessed with living on. You know, it's like we have our egos are the biggest issue with this. You know, it's like I'm a peon. I'm very glad that I've been blessed with living as long as I have, and I'm going to continue to live with as much compassion, love, and awe as I can. You know, it's because it's really great to be alive, even in unprecedented times that we're living in now. You know, it's like you can't get stuck in bad, and you can't get stuck in fear. You know, it's okay to be afraid when you have a symptom. You know, you can be afraid. You know, I think a lot of people are afraid of dying. I'm not ready to die at the moment, but I'm okay if I do. I have no control of it. You know, it's just that. You know, having someone say you can control it, it makes me think, yeah, no. You know, I'm 6 years in. I don't have control of it. I'm blessed to be 6 years in. I'm blessed to be mostly intact 6 years in. You know, ALS FSR score is 36. So, you know, not horrible, not great. Breathing is good. Hey, keep that. There's no answers. You know, I don't know why I'm living this long. I don't know why. I'm glad. You know, it's like the more that you live longer, you know, the people that know you from work, from social events, you know, you lose some of that interaction. You kind of get lost in, you know, the anonymity. That's kind of hard, you know. I'll take each day. I'm looking forward to getting my yard a little more spooky with my yard haunt, and happy to see all the different costumes and the little kids get scared. And do a jumping spider on Halloween night towards the end of my driveway. They always make me jump, but you know, just little things, just kind of, you know, celebrate, you know, the seasons. You know, Thanksgiving's gonna be fun. Christmas is gonna be really special. You know, precious. I have 2 granddaughters now. You know, it's my first granddaughter's. You know, she's now into the Halloween. She's gonna be a princess. And my second granddaughter is going to be a pea in the pod. And my youngest daughter is going to be some character I have no idea of, but I've ordered her the brown feathers that she needs. Kids. You know, it's just, life is precious. You know, just kind of doing another check-in. You know, I'll let you guys know what they find out about my stomach. And, you know, my thoughts on whether I actually do the feeding tube. Right now, I'm thinking no. You know, just the swelling of my abdomen back and forth with my heart stuff. You know, I just can see a skin breakdown and having sensitivities to tapes and all that. I just don't think I want to go through that. So if I can't eat, that takes something away from life. You know, I'll just keep sucking on my smoothies. Hey, you know, Costco's berry mix. You know, raspberries, blackberries, and blueberries. And blueberries are good for your brain. And, you know, the mix with that with kale and spinach and everything else with that, you know, it's like, that's good for your body. But, you know, it's just that little bit of joy, you know, a little bit of fiber and a little bit of joy in the day. So if I can do that and not vomit, I will do that. You know, fingers crossed we'll figure out what it is. But I hope you guys are doing well. I hope everyone that's in pain finds comfort and finds the right doctor for them. I hope that those that are questioning whether they have ALS find out the answers. Those that have ALS know that you're not alone, that things do shake out, and finding the answers that you need. You have to be your own self-advocate. You know, you have to find a good team to help you with it, but don't stop advocating for yourself or your partner ever. You know, it's important. But remember to find joy, a little piece of beauty in each day, because it's there. You can find it. And that's what's going on with me. All right, you guys take care.